Hello everyone, I am Dr. Aarti. Today we'll see important topics in blood vessels. So before going to the disease associated with the blood vessels, we'll see a small introduction about blood vessels. So the function of blood vessels involves transport of blood, also involved in the regulation of blood pressure. So coming to anatomy, the blood vessel has tunica intima, tunica media as well as tunica externa. In tunica intima, it has a single layer of endothelial cells. And in tunica media there will be smooth muscle cells. So this endothelial cells and smooth muscle cells plays an important role whenever the blood vessels undergoes some injury. The tunica adventitia as well as the outer half of tunica media are supplied by vasa vasorum, and the innermost layer receive the nourishment by diffusion. Hypertensive vascular disease. This is the most important topic. Many MCQ will be coming. You will be studying in detail in medicine regarding the types as well as the drugs used to control the blood pressure. Coming to types, there are two types. One is essential hypertension and secondary hypertension. So essential hypertension is idiopathic causes, and secondary hypertension there are various causes associated with, like renal artery stenosis as well as Cushing syndromes. We'll just see the pathology behind the hypertensive disorders. So how the blood pressure is regulated? So blood pressure is a function of cardiac output as well as peripheral resistance. This is influenced by various factors. So cardiac output depends upon the stroke volume, that is blood volume, as well as cardiac factors, that is heart rate as well as contractility. And peripheral resistance depends upon both humoral as well as neuronal factors. So humoral factors involves angiotensin II, thromboxane, endothelin, nitric oxide, prostaglandins, and neuronal factors involves alpha adrenergic as well as beta adrenergic factors. So whenever there is a volume overload, the heart muscles will produce atrial natriuretic peptide, which may cause vasodilation, and there will be a reduce in blood pressure. Whenever there is a low blood flow to the kidney, the juxtaglomerular cells will produce renin. This renin converts the angiotensinogen to angiotensin-1, and which acts on endothelial cells in many tissue and produce angiotensin II. This angiotensin II acts on adrenal and produce aldosterons. This aldosterons may cause vasoconstrictions and increases the blood volume, thereby maintaining the blood pressure. So the main vascular pathology behind hypertension involves, it accelerates atherogenesis. Atherogenesis is nothing but increase in fat deposition in the blood vessels and cause many degenerative changes in the blood vessels. And another most important pathology we can see in the blood vessels associated with hypertension is atherosclerosis. So arteriosclerosis is nothing but hardening of the arteries. This arteriosclerosis can be of hyaline arteriosclerosis as well as hyperplastic arteriosclerosis. Hyaline atherosclerosis is nothing but the wall is thickened due to increased protein deposition. We have seen that endothelial cells will be defective, so there will be increased protein deposition in the blood vessels. And hyperplastic atherosclerosis, we can see a laminated onion skin appearance along with luminal narrowing. In hypertension, we can also see Mockenberg medial sclerosis. The Mockenberg medial sclerosis is characteristic by calcification of the medial wall of the muscular arteries, and we can also see fibromuscular intimal hyperplasia, which occurs in muscular arteries which are larger than arterioles. Then coming to the next important topic in blood vessel, that is atherosclerosis. So atherosclerosis is nothing but a atheromatous plaque with a raised lesion with a soft core of lipid, which composed of mainly cholesterol as well as cholesterol esters, which is covered by a fibrous cap. So risk factors is a most important MCQ questions. It can be of non-modifiable and modifiable risk factors. It involves genetic abnormalities, family history, increasing age and male gender, hyperlipidemia, which involves increase in LDH, hypertension as well as cigarette smoking, diabetes and inflammation. CRP is a most important inflammatory markers which has been associated with atherosclerosis. Other risk factors involves hyperhomocysteine, metabolic syndromes as well as lipoprotein A. So the pathogenesis associated with atherosclerosis involves whenever there is an endothelial injury due to hyperlipidemia, hypertension, smoking, homocysteine, hemodynamic factors, toxins, virus or immune reaction, there will be a endothelial dysfunction. So there will be increased permeability. So the cells in the blood like leukocyte and monocytes enter into the vessel wall. So macrophage will get activated and smooth muscle requirement can also occur. This macrophage as well as smooth muscle cell which gets activated will engulf the increased lipid in the blood vessel and form the initial lesion, that is fatty streak. And further it will cause smooth muscle proliferation, collagen and other extracellular matrix deposition and form a atheromatous plaque. The morphological lesion which is seen in atherosclerosis is fatty streak. This is the earliest lesion, and further we can see atherosclerotic plaque. This atherosclerotic plaque contains smooth muscle cell, macrophages as well as T lymphocyte as well as extracellular matrix including collagen, elastic fibers as well as proteoglycans. There will be also intracellular and extracellular lipids, and calcification can be also be seen. The most common vessel which has been associated with atherosclerosis is lower abdominal aorta. This is the most important MCQ. Lower abdominal aorta is the first vessel to be involved, followed by iliac arteries, next coronary, popliteal, internal carotid arteries and vessels of circle of Willis. Usually atherosclerotic lesion can be seen at the branch points. So in this two gross photo we can see the atherosclerotic lesion. Here we can see the fatty streaks are there. This is a ulcerated atherosclerotic plaque. This is a histological image. We can see the blood vessel, the lumen has been reduced, and this is the atherosclerotic plaque. Here you can see the fibrous cap which is made up of collagen and the center necrotic core. So the secondary changes seen in atherosclerosis are rupture, ulceration and erosion leading to thrombus formation and hemorrhage in the plaque. Usually in atherosclerotic plaque there will be neovascularization, that is the formation of new blood vessels. These blood vessels are not strong, they are thin walled vessels, so they can rupture and form a hemorrhage into the plaque and increase the atherosclerotic plaque. And there can be also atheroembolism and aneurysal formation. This aneurysmal formation is mainly due to ischemia of the media. Okay, so the vessel wall will be weakened. The main consequence due to atherosclerosis involve MI, cerebral infarction leading to stroke, aortic aneurysms and peripheral vascular disease leading to gangrene. So critical stenosis is the most important question they will ask for Viva. So critical stenosis nothing but is a stage in which the blood vessels, the occlusion is very severe to cause tissue ischemia. This occlusion will be there will be a decrease in 70 to 75% decrease in the luminal cross-sectional area of the blood vessels. So we'll see the important questions related to atherosclerosis. So all are true except omega-3 fatty acids decrease LDH. It's true. So omega-3 fatty acids seen in fish oils and usually decrease LDH. So we'll see whether other polyunsaturated fatty acid will increase the LDH. So atherosclerosis is less important in age group more than 45 years of age. We have seen that increase in age is the most important risk factors for atherosclerosis. So this statement is wrong. Cigarette smoking is an independent risk factor for MI. Yeah. CRP is an independent risk factor for MI. Yeah, that is also true. Inflammation and cigarette smoking are important risk factors for atherosclerosis, and consequence for atherosclerosis are MI. So the answer is atherosclerosis less important in age group more than 45 years of age. So the next question, the most common histological finding seen in benign hypertension. So we have seen the vascular pathology associated with hypertension are hyaline atherosclerosis and hyperplastic atherosclerosis. So the answer is hyaline atherosclerosis. The most common causes of abdominal aortic aneurysms is atherosclerosis, syphilis, trauma and congenital. So the answer is atherosclerosis. So atherosclerosis will damage the intima layer, media layer of the blood vessels. So it may cause vessel weakening and leading to atherosclerosis. All are seen in malignant hypertension except. So in malignant hypertension, what features we can see are fibrinoid necrosis, necrotizing glomerular nephritis, and hyperplastic atherosclerosis. So the answer is hyaline atherosclerosis. We have seen in benign hypertension, hyaline atherosclerosis is the pathology seen in the blood vessels. So however, in malignant hypertension in kidney, flea-bitten appearance can be seen. This is also important MCQ. So coming to the next important topic, aneurysms. So aneurysm is nothing but a localized abnormal dilation of the blood vessels or the heart. So aneurysm can be of two types. One is true aneurysm as well as false aneurysm. So true aneurysm is nothing but all the layers of the intact arterial wall or the thin ventricle wall of the heart can be involved. So the causes of aneurysm can be atherosclerosis as well as congenital causes or ventricular aneurysm which are result due to transmural MI. Morphologically, the true aneurysm can be of two types. One is saccular as well as fusiform. So false aneurysm, that is pseudoaneurysm, is a defect in the vascular wall leading to extravascular hematoma that freely communicates with the intravascular spaces. It is also called as pulsating hematoma. So the main causes is the rupture after MI and leakage of the site of vascular anastomosis. So the main pathogenesis behind the aneurysmal formation is the defect in the structural and functional integrity of the vessels due to the damage in the extracellular matrix constituents. So it can be of both congenital or acquired causes. So congenital causes can be Ehlers-Danlos syndrome, in which there is a defect in the type 3 collagen, Marfan syndrome where there is a defect in fibrillin. Next is Loeys-Dietz syndrome, in which there is a mutation in the TGF-beta receptors. Increase in TGF-beta signaling is found with the degradation of the extracellular matrix constituents, this leading to weakening of the blood vessels. Acquired causes can be tertiary syphilis, which is associated with thoracic aortic aneurysm. This syphilis will cause obliterative endarteritis occurring in the vasa vasorum, leading to vessel wall weakening. Next important cause is hypertension. This hypertension has been associated with ascending aortic aneurysm and atherosclerosis has been associated with abdominal aortic aneurysms. And other important cause is infection. We can see mycotic aneurysm which usually results from infective endocarditis or extension from the adjacent suppurative processes. So complication associated with aneurysm involves rupture. This may cause fatal hemorrhage, obstruction of the branch vessel resulting in tissue ischemia, embolism from atheroma or a mural thrombus, impingement on adjacent structure, for example, compression of the ureter or erosion of the vessels. So rupture, the risk of rupture is usually related to size. So size more than 6 cm usually requires surgical intervention. Then coming to aortic dissection. This aortic dissection usually occurs when blood separates between the laminar plane of media to form a blood-filled channels within the aortic wall. So the main causes for this aortic dissections are hypertension and Marfan syndrome and rarely pregnancy. And the pathogenesis behind is medial degeneration. So first initially there will be intimal tear will occur in the blood vessels through which the blood may enter into the media and form a blood-filled channels. This usually occurs involving 10 centimeters of the aortic wall. So aortic dissection can be of two types, type A and type B. So type A, it involves both ascending aorta as well as descending aorta, and type B, it involves only descending aorta. So type A is more complicated when compared to type B. So complication associated with this aortic dissection is rupture and double barrel aorta. So double barrel aorta is nothing but first there will be intimal tear through which the blood from the lumen enters into the media, and there will be a second tear through which the blood again enters into the lumen. So the patient usually comes with severe pain, which usually confused with MI, aortic wall insufficiency as well as cardiac tamponade. So coming to questions, elderly male has abdominal pain with a mass in abdomen. Angiography reveals aneurysm of aorta. So what is the most likely causes? So the causes of aneurysm can be both congenital as well as acquired. So congenital causes usually we see in younger age group. This is elderly male. So the most important causes will be atherosclerosis. The most common site of atherosclerotic aneurysm is abdominal aorta. Okay, so for hypertension we have seen the ascending aorta. For atherosclerotic aneurysm, the most important site is abdominal aorta. Most common cause of descending hematoma is hypertension. Cystic medial necrosis is seen in option A, Marfan syndrome, option B, Freitas atresia, option C, Down syndrome, and option D, Gavaski disease. So the answer will be Marfan syndromes. So these are the most important points which can be asked by MCQ. Visceral aneurysm is common in splenic artery. Peripheral aneurysm is seen in popliteal artery, and tree barking aorta is seen in syphilis.